Now we are looking at this will be our introduction to this will I say lecture, to this segment of what obstetrics and gynecology. All right, so we'll be looking at vulvovaginal lesions. Okay, so under the vulvovaginal lesions, we'll also still look at other conditions that could actually affect, the vagina. All right, and its associated structures. So look at labial agglutination, look at imperforate hymen, we look at vaginal discharge. So this lecture is more of like an introduction to this whole concept. Do you understand? So later on, we'll still do individual videos on each of these issues. Okay, so let's take them one by one as a mode of just introduction. So vulvovaginal lesions are just issues that could actually affect the vulva, which is the outside of the vagina, and the vagina itself. So examples are what we have listed as what: labial agglutination, imperforate hymen, vaginal discharge. So they can be common in children, they can be common in adults. Okay, so looking at the first one, which is labial agglutination. So this one is just fusion of labia minora. So you often see it in girls that have not hit puberty, right? So causes estrogen levels are low, or maybe there have been so much inflammation or irritation at that region. Okay. Then symptoms is urinary dribbling. So she's easing herself and it's not a straight stream, it's scattering. So diagnosis, you visually see it. So treatment, sometimes since she's a little girl, you can just observe. Okay. Then because estrogen is little, you can rub estrogen. Then gentle manual separation in rare persistent cases. So imperforate hymen, which I didn't actually bring the picture for it, but of course everybody here should know what a hymen is. Okay, so the hymen, there's no opening on it. Okay, that's like the door to the outside of the vagina. There's no opening, so it can cause menstruation or any fluid to be locked back because there's no opening for it to get to the outside. So it can lead to accumulation of menstruation blood. That's when the person hits menstruation age. Okay, urinary retention. All right, so diagnosis, all this physical examination. Then treatment, you can surgically create an opening in the vagina. So vaginal discharge is what we have here. So it's just those fluid that your vagina naturally makes, but sometimes in terms of disease, okay, these natural fluids could now be taking some other looks. So this is fluid from the vagina which may be physiologic or diseased. All right, so in children we see it there, and in adolescents sometimes if there's changes in it is due to infections or hormone changes, right? So all of this, you take history, do physical examination, do vaginal swab if possible. Then treatment, you basically handle it based on what is actually causing a change in the normal vaginal discharge, right? So just like I told you guys, this is a mode of introduction. We'll still come back to these issues one by one later on.